Welcome to the Pre-Health Pod. My name is Lexi.
My name is Natalie.
And we're a podcast by students for students who are currently going through undergrad or have already done it, but are here to meet you wherever you are on your journey to healthcare. I'm very pleased to have Alyson Dottery join us. Did I pronounce that right, Alyson?
Yes, that's right.
Oh, perfect. And Natalie, feel free to introduce her.
Yeah, let me just introduce her because Alyson is a very close friend of mine. So I'm very excited to have her on the podcast today. But yeah, so this is Alyson Dottery, and she is currently a junior at Barrett the Honors College at ASU, like me. She is originally from Allentown, Pennsylvania, where she was born and raised until she moved away to come to Arizona. And she is majoring in biomedical sciences with a minor in business, pursuing a dental career, and she is applying in this current dental cycle. She is also on the executive board of the Predental Society at ASU as an Operation Toothbrush Lead, and she is involved in volunteering and in the community and also volunteering in Panama. And also, she is interning at a dentist office and gaining experience that way. So that was a hefty introduction, but welcome, Alyson. We're so happy to have you.
Thank you. I'm so excited to be here and introduce dentistry to the podcast.
Yay!
Yeah, you're our first dentistry related guest. We need a dentist on here, but I know you'll do a great job representing the dentistry field.
Yeah, it'll be a bit of a different
it.
perspective because it's more like pre-dental. So obviously I don't have all the answers for everything, but I can talk a little bit about the pre-dental experience and taking the DAT, and I'll be applying soon. So
awesome.
I have a little background on that.
Yeah, okay. I'm very curious about the journey. And even if you're not currently interested in dentistry or, are just only pre-med and wanting to go to medical school, it is very important to have an understanding of all the other healthcare careers that are available to you. For example, I work as a scribe in a dermatology office, and I have patients come in all the time with complaints about their teeth, and they're just asking quick questions. And my dermatologist does a good job of referring them to dentistry and explaining how they can get better care. And it's just a good idea to have a general understanding of what people in this career path go through and how they apply, because we're all trying to help people and we're all trying to care for our patients, whether or not it's in dentistry or dermatology. But with that said, I want to ask you, Allie, what made you want to go into dentistry?
So it's kind of a long story. I always, obviously, as most people have been that are going into this field, have been more interested in science and that part of in high school and going to college. Obviously, I chose biomedical sciences. So I always knew that I wanted to do something in science, and I like the medical field, the healthcare field. But I wasn't exactly sure what I wanted to go into. And in high school, we had a program called the Emerging Health Professionals Program. And that for half of the day, we went to, we either took classes at Penn State, Lehigh Valley, or LCTI, which is just a technical school near me. And we would just it was during COVID. So we were supposed to be able to have shadowing experiences and stuff like that, but we didn't get the full experience with that. But we were just introduced to the healthcare field and different careers in the healthcare field. And I had a lot of opportunities through that. One thing that we didn't really talk about much, though, is dentistry. I don't really think that was mentioned much at all in the program, because I do think dentistry is often forgot about in pre-health programs and clubs and stuff like that. So I'm excited to talk about that today, because I didn't get that exposure in that club. So I never really thought about dentistry that much.
That's so interesting to me, actually, Allie, because I feel like since I've been at ASU, so many people in our science classes are pre-dental. So it's so interesting to me that you didn't get that exposure.
Yeah.
I mean, I didn't get that at ASU. Actually, I don't think I know anybody.
Really?
It could just be because you're roommates with me and then I'm with some other people. So
that is true.
Oh yeah. Them a lot.
Me and Allie are also roommates. I didn't even mention that. we live together, so I do get a lot of the dental perspective, but just in general also, I have a lot of other friends in like my labs that talk about going to dental school. And I'm like, that's awesome. But it seems like it's a pretty competitive process, so they need to be
they're definitely, I
explaining
do run
this
into a lot of pre-dentals at ASU, more so than I would
than
expect,
outside.
but
Yeah.
yeah. But I don't know. I never really got that kind of exposure to it before. So I wasn't really sure what I wanted to do. But through that program that I did in high school, I was able to get EMT certified. So I did, that was a separate program that I did, obviously, but
That's so cool.
I know.
I wish I was an EMT.
Yeah, I think by now my license has expired, sadly.
Aw.
But
Yeah, I want to learn a little bit more about that. So, how long were you an EMT for?
the license, there's two kind of. You are nationally certified and then certified for your state. And I'm not sure which is which, but one of them lasts 2 years and one of them lasts 3 years.
Okay.
So I got it my senior year of high school.
Oh, wow.
I guess technically like June, I think, is when I took the test to get certified. And then it would last 2 to 3 years, depending on which
So, did you
certification.
work as an EMT?
Yes, I did, but I didn't work on an ambulance at all.
Oh, okay.
So, I worked at an amusement park
Oh,
as like a medical responder was the
unique.
job title.
yeah.
But
That
we
is
had
so
to be
fun.
EMT certified for it, and I honestly really loved that job. Like after going through the EMT class, I guess, and all of that, like that's kind of where I realized that medicine, like med school, is not really my fit.
Which is fair. Very fair.
So I'm glad that I did that because it helps me realize that and like narrow it down. But then I was kind of lost because I was like, I'm not sure where to go from here because I still hadn't really thought much about dentistry. But yeah, I did love my job working as an EMT. I did that for 2.5 summers, kind of. And it was a great job,
Yeah.
but it just wasn't what I wanted to do.
Can you tell us a little bit more about what you did at the amusement park as an EMT then? Or like
Yeah, so
with medicine you had there? Just because I don't know how it works. I've never been an EMT, so just curious.
Yeah, it's not, we weren't like full on EMTs there, obviously.
Right.
It was a lot of kids coming in who fell down and had like a scrape on their knee, or a lot of people getting sick, a lot of heat illness. That was a big one.
Yeah.
But there were some other things that were more serious. Like people would, there, when I was working there, I wasn't working that day, but there was somebody who needed CPR in the park.
Yeah.
There's seizures. There are obviously people passing out from the heat or other things. And we would just like bring them in, treat them as much as we could. If they needed to go to the hospital, we would call an ambulance and the ambulance would get them. So we would just pass them off to more EMTs or like paramedics.
Oh, yeah. I saw people with heat illness all the time in the ER.
Yeah, that was a big
Especially
one.
in Arizona.
Yeah.
I know. I always thought about that because I would do it in Pennsylvania.
Right.
And I couldn't imagine in Arizona.
Yeah. No, it's probably really bad over here, but that's really awesome, Allie. It sounds like you had such a good like exposure to medicine there then. And it's kind of funny. Oh, go ahead.
Oh no, you're good. It varied obviously by the day. If it was rainy or cold, it wouldn't be as busy, but when it was like a hot sunny day, we would be really busy and have a lot to do. But
nice.
Well, I want to talk a little bit more about applying for a career in dentistry and what you need to do in undergrad to prepare for that. Is it similar? I don't know if you're familiar with like the medical school application process, but for us, a big part of the application is having clinical experience, working in a medical field or a medical setting. So you kind of have an idea of what you're getting into. Do you have to do something similar for dentistry?
Yeah, it's pretty similar. We have to do like shadowing and volunteering and have
Okay.
experience in the field. I think it depends on the school, obviously, but I think it's usually about like 100 hours minimum of shadowing.
Oh, okay. So they like
And
require you need 100 hours of shadowing.
yeah,
Okay.
yeah.
Oh my
And then
gosh.
is that not how it is for med school?
No, it's
No.
not.
Oh,
I
really?
think
I didn't
it's
know
pretty
that.
hard to get shadowing hours, I think, for
Yeah.
medical because you need to be very well connected. And it's also, I feel like there's a lot of rules and regulations with different doctors taking shadows.
Yeah,
So,
there's
That's so interesting.
no set number of hours that you
no.
need for shadowing and what we call also clinical experience. So for medical school, you don't necessarily like need shadowing. You don't necessarily need anything. There's no requirements for experiences. However, it's highly encouraged to be a competitive applicant. You have especially clinical experience. So having like a position working in a medical setting, that could be volunteer, it could be paid, but not shadowing. Like they like don't count that as clinical experience, which is pretty
Okay,
interesting.
that is
Um,
interesting.
but there's no minimum number of hours.
Yeah, shadowing is like a big thing that they want you to have
Okay.
because especially from like a general dentist, because there are obviously different um specialties like orthodontist, endodontist.
Do you think that you might want to specialize, Allie, after you complete your dental training?
Yeah, maybe. I'm not really sure yet. My options are open right now.
Yeah.
I
Yeah, that's
haven't,
classic motto for all of us pre-health students.
yeah.
Don't worry.
Yeah, we'll see where life takes me, I guess. But right now,
Yeah.
I like general dentistry. I work in a general dentist office right now,
Oh,
and I've
awesome.
shadowed general dentists. So I know I like that.
Yeah.
Awesome.
Specializing, maybe.
Mhm. Well, what do you do in the general dentist office?
I'm kind of like interning right now, so just to like get experience in the office, but I think I get like a pretty overall experience because I get to like sterilize and that helps me like learn the instruments and everything like that.
So do
And
you like
then
assist the dentist when they're working on the patients or like what do you
sometimes,
do with the
yeah,
tools? Okay.
yeah. Um, Sometimes when they're doing like fillings, I'll
Yeah.
assist and just like hand them the tools, hand them what they need, get that for them. And then I'll also like set up for procedures and clean up afterwards, like break down the room, clean it,
Awesome.
sterilize it. And I just started working on learning the front office stuff. So that's new to me too, but that's also a really important part of running a dental
Yeah.
office. So I'm excited
Yeah.
to learn about that.
And
That's
keep
why it's
doing that.
so, yeah. I was gonna say that's why it's so awesome that you're minoring in business, Allie, because that's gonna really help you when you're running your own dental clinic.
I know. Yeah, business is really important. So I'm glad I'm getting a little bit of that now.
Yeah.
Yeah, it's also so important to have just an understanding, a general understanding, or as much as an understanding as you can of what your staff members do in your clinic or your practice. Some issues I've run into the past with physicians I previously worked with is they don't know the weight of responsibilities all of our staff members have. And so sometimes they can get overwhelmed with tasks. So if you can understand what like everybody does, what each person does in your clinic, and you can have a better understanding of what to task them with too. It'll make a better practice. So that's awesome that you're doing that. And how did you get involved in the general practice or in the general dentistry
Um,
practice?
so this job I actually got in a funny way. I was volunteering at like a free dental clinic in my area. They have one once a year, where it's just I think 2 days where people can just come and get whatever they need to get done that they haven't been able to get done. And I was volunteering there as just like a lay volunteer, basically just running the patients to where they needed to be, bringing them in. And when I was eating lunch, the dentist that was sitting across from me, we just started talking, and he worked about an hour from where I live. So it's a little bit far of a drive, but we were just talking, and he offered me to come in and start working for him. And
That's awesome. You made such an
Yeah.
impression.
I was currently working at the amusement park as an EMT at the time.
Right.
And
She was a star employee there.
So was it
I know,
that
I was just
moment
about
that like
to
was it that
go.
moment that got you into dentistry when they gave you a job in that practice or?
No, I had known that I wanted to do, sorry, I never finished that part of my why dentistry, but um I just, how did I realize actually? Um
For a lot of people, it's also just like such a gradual thing, you know?
Yeah,
Like there's
yeah.
not always a one like aha moment.
That's
yeah,
true.
no, I
Yeah.
think
It wasn't for
what it
me.
was for me at least with like the being an EMT and like doing that as a job, um it was very much like temporary fixes. Like it was like just make sure the patient is stable, get them to the hospital, mask their symptoms, like treat their symptoms for
Yeah.
now and get them to the hospital, and then they'll obviously do more. But medicine, like the medical field, at least from what my experience of it was very much treating symptoms rather than treating the actual cause of the problem.
Yeah.
And with dentistry, it's not like that at all. Like you're actually treating the problem and then the symptoms go away as a result of that. Like there's an infection in the tooth, you get a filling or extract the tooth or whatever needs to be done, and the problem's cured. Like they don't have pain anymore, their symptoms go away. And I just really liked that part of dentistry. So I just started doing more experiences in dentistry and stuff like that. And I just realized that it worked. That was
for
what I
you.
liked. Yeah, that was
Just
for me.
clicked.
Yeah.
Nice.
Yeah. And then like this job and everything just confirmed that further, that
That's
this is what I
awesome.
like.
Well, tell me about the application process. So, um, how is it different? Or I guess just tell me how your story is going. Is it like a year-long process, a couple months? When would you know if you got into dentistry school? Things like that.
Yeah. So I think it's similar to med school. And it's like a cycle. So you
Okay.
apply and like June 1st is when the application opens. And then usually most people want to apply as soon as possible after that. And interviews will start over the late summer and the fall, I believe. And then you will find out in December, usually. Like that's when they'll start releasing.
Like
Who,
acceptances or interview?
yeah, acceptances.
Oh, in December. That's a lot later
Yeah,
than us, actually.
really.
Yeah,
When do
so
you guys?
our application does open as well, like May 30th was this year, I think. And then and October 16th is the first day medical schools can release acceptances this year.
Okay. Yeah,
Did you guys
I
have secondary applications or anything like that, or is it just one application?
yes, there are secondary applications. I haven't gone through the application process yet, so I'm not 100% sure
Oh,
on
okay.
any of this. I'll be applying I'll be applying this cycle. Um, so hopefully I'll find out in about a year.
So you'll apply next June?
Yeah, like this
Yes.
coming June.
Oh, okay.
The
And they
upcoming
start,
cycle.
do they take a whole year to matriculate?
What do you mean?
Like when
Like,
would you start school if you got in?
Oh, I would start the following year.
Okay, the
So
Gotcha.
fall
if
of the following year.
yes, so if I'm
Okay.
applying this June, I would start fall 2025.
Nice.
nice. Well,
I'm so excited for you.
do most medical schools require the DAT? Do you call it the DAT or do you call the DAT? I don't know.
I think people call it both. I always call it the DAT, but both of
Yeah.
them, it both works. Yeah, you need to take that to apply.
Yeah,
It's like the
and
MCAT, like it's just
Allie
Yeah.
did. She's done
I
with
did.
hers.
I
Oh,
did some for this summer.
congratulations.
Thank you.
We're
Well,
very proud of her.
Too.
What does that test look like? Like how many
Yeah.
sections are there and how much how long did it take you to prepare for it?
Yeah.
So there's different, I did a program to do it. I think most people will do a program like this. I did DAT boot camp, which worked really well for me, but I know there's also like DAT booster, I think it's called, and that works really well for people. Some people do both. I just did boot camp, and I did the 3-month subscription. So I studied for 3 months straight. Basically, I took like 2 weeks off to go on vacation, but basically 3 months straight. And I did it this past summer. So pretty much from when I graduated, or not graduated, when I finished this semester in the spring until when I left for Spain, because I studied abroad with Natalie this past semester.
She actually did.
Oh
Yeah,
my
we were in Spain
gosh.
together.
We'll get to that.
The lore is unfolding as we keep talking or figuring out more and more about me and Allie's friendship. But no, yeah, that's awesome that you completed your test already. I don't even think you ever ended up telling me much about your DAT, Allie, after you were done with it. But would you say that was like an appropriate amount of time to study? Do you think you would recommend that people study for at least 3 months, or do you think that maybe you could do it in less time, more time? What do you think?
I think 3 months is like a pretty good amount of time. I know like a couple other pre-dental students that I'm friends with also took theirs this summer and did the 3-month program. But I also do know a few that did that 3 months and then didn't feel ready, and they did push off their tests, and they're taking it like probably around now at the end of this month or something. They did push it off. So I guess it just depends.
That's okay. It's important to know when you're ready or not. If you get that extra time, you got to give yourself that extra time.
And I think the main difference is that I took a lot of my course science courses earlier. So they were trying to study and they hadn't taken biochem yet or cell bio. And those are really big topics. I noticed like when I was studying, I was like, wow, I do not know how you guys are doing it, because this is a lot of biochem that like took me the whole semester to learn, and you guys have to do it in like a couple hours. Like you got to get through the lecture and move on. But
so your guys' test for the DAT is also a lot of biochem, because I know MCAT is like a ton of biochem.
Yeah, I know for the MCAT, it's like there's a biochem section, right? Like a whole section for biochem. We don't.
It's kind of interspersed, I think.
Okay.
Yeah.
Right?
So
Lexi,
for
she's
us,
taking it.
the first one, so there's 4 sections. First section for us is chemistry and physics, basically with organic chemistry in there. The second one is CARS, which is critical analysis reasoning section. I think
it's just like reading.
You guys have a reading section as well, right?
Yeah, we do.
Okay. And then our third one is biology and biochemistry, but they have like specific names for these. I'm going to look it up. I love how I completely forgot already.
Okay, yeah. Yours.
So it's like they call it chemical and physical foundations of biological systems, biological and biochemical foundations of living systems, psychological, social, and biological foundations of behavior, which is the psych section, and then the critical analysis and reasoning skills, CARS. Basically, everything is kind of all over the place. Like I've seen like biology related questions that have a chemistry focus in the chemistry section, if that makes sense. So
yeah, that's interesting. I think they do a pretty good job of separating it for the DAT, which I really like. The first section is all the sciences. So there's 3 different sections. It's bio, and then gen chem, and then ochem. And that total section is an hour and a half. And I think it's 100 questions. And then we do the PAT next, which this one is like very interesting of a section, but I really liked it. I thought it was fun. It's like little puzzles kind of.
The PAT?
Yeah, it stands for perceptual ability test, I think. Perceptual ability. Yeah, that's what it is.
Yeah, and I can vouch because I saw when she was studying and looking at the PAT section, and I looked at it and I said, thank God we do not have to do this on the MCAT because it is, my brain does not work like that.
Wait, is that like the concussion test? Like, what is that?
Honestly,
explain it, Allie.
Yeah, I would send Natalie pictures of them sometimes when I was first starting. I was like, oh my God, what is this? I'm never going to be able to figure this out. But
I had no idea.
they give you like 3D shapes. Sometimes they're like rocks, and you have to figure out which like keyhole they would fit into, but they're like off by like a centimeter of like length or something. It's just like I think there were 6 different like sections inside the PAT. So it was keyholes, top, front, end. So that's like, I don't know if you guys know the like I think it's engineering where, or like, I don't know, where they give you like a blueprint kind of, and then you get like 2 angles of it, the top and the front, or the top and the side, and then you have to figure out like the 3D shape of it. I wonder if I can pull up any example.
Well, we can't really show them.
That's true.
It's like
Yeah,
just kind of spatial reasoning, right? Kind of a thing.
Yeah,
where
it's
you
like
just have to
spatial
picture.
awareness. You have to be
Yeah.
able
Yeah.
to see like a 2-dimensional or put together multiple 2-dimensional pictures into a 3D shape, and then
in your mind.
in your mind, and like be able to see it from all the different angles and like
Yeah.
apply it to
And I'm
questions.
horrible at those. You know, those tests where they give you like the squares laid out in a certain pattern, and then you have to like say what shape it would fold into, and they give you like options. I am horrible at those. I don't think I've ever gotten one of those right.
Does excelling in that make you a better dentist?
Right?
Yeah, I think because you have to be so like spatially aware of like the tooth dimensions and everything, and they're so
That is
small.
a good point.
Yeah, I think that's the application for it.
You know, I will say I think that it's also important for like people want to go into surgery too, because I went to an interview recently and they had like it was in person, and we went up to these little laparoscopic surgery stations, and it was basically a test that tested your spatial awareness and your like hand grip and technique, and they were saying you had to pass the test in order to pass your boards as a surgeon.
Okay.
And it was kind of like a puzzle, but an in-person puzzle.
Yeah.
Wow.
Yeah, it's kind of is like a puzzle. I thought it was fun. That was my favorite section. Like
Allie was really good at it.
Oh, good. We're like, that sounds terrible. But you're loving it.
Yeah, it sounded terrible to me, not to her.
It definitely was difficult at first, but for me, once I got the hang of it, it worked. I was able to see it pretty well.
Do you have any tips for people that might not just like get it like me? If I was to be taking the PAT, what would you say?
No, honestly, you do need a lot of practice. Like you need to do it a lot. Because you also have to be really fast with it, because I think we had to do 90 questions in an hour. So you didn't even get a full minute to look at the
wow.
That is fast.
Interpret it. Yeah.
Do a lot of people not finish that section? Is that a common thing to
I'm not sure, honestly. For me, all of my sections were like right, like I was going right to the time.
Wow. Okay. So not really any checking your work.
No,
yeah, no.
not.
I didn't
even
do that for the MCAT.
Is that how it was for you, Lexi? You didn't have time to go back?
Yeah, I think on my Chem Phys section, which I actually did pretty well on, I think I guessed on the last 5 questions because I ran out of time.
Okay.
The last 5 were 10. I was struggling with that even when I was practicing. I kept time, but
no, I sometimes have that problem too. Yeah, you're done now. But I like to overthink, so I'm gonna have to fix that when I'm doing my MCAT prep.
Oh, girl, I'll help you.
But yeah, I think when I was taking my SATs, I had that problem. I would be right down to the time. But I know there's no guessing penalty for the MCAT, so that's good.
There used to be, I think.
Penalty for the DAT?
Is that where like you get
they'll like subtract points if you're guessing or something like that?
No, I think like a wrong answer and a skipped answer are the same. Good. Like you don't get penalized for a wrong answer. Yeah.
Okay. Got you.
That's good. That's just mean.
Yeah, it is. I'm not like when people do that. I don't know if any tests do that anymore though.
Yeah, I don't know.
Nice. Well, I want to ask you, when I read your bio before we met today, I want to learn more about what it means to be an Operation Toothbrush Lead. Can you tell me about that?
Yeah. So that's for the Predental Society at ASU, which is just like the pre-dental club, which for anyone listening that goes to ASU, it's an amazing club. I've honestly
shameless self-promo. I love it.
Met so many other students, and everybody will like help you and it's just a really great community, and I've learned so much through that club. But yeah, that's the position I am on the e-board. So we basically do like volunteering. We coordinate volunteering activities with like, no, they're not schools, but they're organizations with like kids, like almost like after school programs.
Yeah, like
that
daycare, after school. Yeah.
Yeah, and we will like go there and just play games with them and do activities and teach them a little bit about like oral health and hygiene and
Oh,
like
awesome.
yeah, it's really fun. The last one that we did, we hard boiled a bunch of eggs and then left them in like Coca-Cola overnight to
Yeah.
stain them. And then we would give them like a toothbrush and toothpaste, and they like brush their eggs to be clean and white, and to like teach them about the staining that can happen and how important it is to brush your teeth and everything like that.
That is adorable.
It
I love that so
was.
much.
I know.
Oh.
They were all so cute comparing the colors of their eggs, like seeing who got theirs the
Oh my
whitest.
gosh. And you know, that kind of
That's so
reminds me
cute.
of when you were telling me about your Panama volunteering, when you helped those children in Panama learn about brushing their teeth.
Yeah, Panama is also another amazing experience that I'm so thankful that I got to go on, and I'm going again. I'm leaving in less than 1 week, actually.
Ooh.
Yeah.
Yeah, I'm
Yeah,
so
it's
excited.
you just are educating people in Panama about
It's
how to brush your
I
teeth.
do it through Global Dental Brigades. It's through a
Okay.
club
Oh, yeah.
at ASU, but they organize it through Global Dental Brigades.
Mhm.
And we do the first day, I think their schedule just got released, so I'm trying to think, but
You can talk about what you did last year.
that's true. The first day is like a cultural immersion kind of thing. Last year we went into one community and they like showed us some of their dances and the songs that they sing, and then they showed us what we made and had set up like a little market that we could buy.
Oh, wow. That's cool.
Yeah, it was really cool to learn about their culture and everything.
Yeah.
And then for the next 4 days, we go to different communities and set up a dental clinic, a free dental clinic that they can come and get whatever they need. We'll do like vitals real quick, get some background history on them and where they have
Oh,
pain, everything like that. And then we can do like fillings, extractions, cleanings. We did fluoride treatments on the kids, and then we would leave them with like vitamins and medicine if they needed it, antibiotics if they got an extraction. And we did
that's
that
such a
for the
great
next
experience.
four
Oh my
days.
gosh.
Wow. That is
Yeah.
very valuable experience.
Yeah,
That's
that is
awesome.
Yeah.
incredible.
It
Is it
was like
expensive?
such an amazing. It is a little expensive.
Yeah. Global Dental. Are
Yeah.
they related to Global Medical Brigades? Are they the
Yes, it's just
same
like a
company?
different subsection of that.
Yeah,
Yeah.
okay. No, I know them really well. I
Oh,
used to
really? Did
work
you
with
do
one of the
one?
leads. No, I
Okay.
didn't, but I used to work for a company that basically like owned them or partnered with them.
Okay.
That didn't own them. They partnered. I was like trying to
Yeah.
think. I was like, no, they haven't bought them yet. Wait, did they buy
Yeah.
them?
I don't know.
I'm
I
not
looked
sure.
into Global Medical Brigades too because I wanted to
Yeah.
do a program like Allie did because it was so fulfilling and amazing for her.
It
She really had a great time there. I remember her telling me about it last year. I'm
it was
excited to
very
hear about it
fulfilling.
again.
I had to go back again. But yeah, one of the
Yeah.
sections there is similar to what we do with Operation Toothbrush. Because it's called Charla, and we just teach them and do little activities. We'll have like
Oh,
Play-Doh and show like the flossing between the teeth to get the Play-Doh
yeah.
out from between the teeth. And we'll play bingo with medical or dental terms. And
That is so fun. They've
it
really made it so fun. I'm obsessed with that.
is really fun. And honestly, we did have some pre-med students come with us to ours last year. So
Oh, awesome.
even if you're not pre-dental, everyone is welcome to join. And they had a great time, great experience. One of them's coming back again this year. So you don't have to be pre-dental.
Yeah, I definitely agree with what you said earlier too about dentistry. It's definitely focuses a lot more on that prevention aspect of the specialty that I don't really get to see too much in other specialties. Because if you brush your teeth, you can really prevent a lot of disease,
Mhm.
like gum disease, which can lead to, I believe it's called endocarditis. That's the inflammation and infection of your heart. Like I saw this
Oh
little brochure one
yeah.
time I was at the dentist. I was like, oh, I didn't know that. And I did see
Yeah.
a patient with that once in the ER, and he did have terrible gums. I don't know if it was related, but
I
you
bet. I
know,
think that people forget that like it's still part of your body and it can influence other parts of your body, and having poor gum health can, like, that's where everything enters. Like you're eating, you're
Mhm.
drinking, and then it enters the rest of your body. And
yeah.
Yeah, and I
yeah,
remember you telling me, Allie, that the people that you were treating when you were in Panama were in a lot of pain with their mouths, or they were
Oh
missing
yeah.
teeth,
Dental
or
pain is so painful.
and that's
yeah,
just a different kind of pain.
right. But
So
that's the thing I like about it is when we're there with the pain that they're having, we're able to like fix it pretty
yeah.
much.
Yeah.
Like once they're done with the procedure, the tooth is either gone or their infection's gone, and then they don't have the pain
Mhm.
anymore.
Yeah.
And
Oh,
that's a really important thing to think about when you're deciding like what specialty or what kind of health professional you want to be, because you got to think about that patient outcome. And for
Hmm.
dentistry, there really is pretty much usually very good outcomes for all of the
yeah.
dental treatment. So
Yeah.
very fair.
I feel like top 5 most pain I've seen in the ER was people with dental pain. We had a lot of people come in with tooth
Really?
pain.
Top
Yeah.
five?
Oh yeah. Oh yeah. Like I'm thinking back on that. That hemorrhoids, I think, was up there for like this is totally not
Yeah.
statistically accurate at all. This is just how I feel and like
Personal
what I've seen
experience.
in the ER. Personal
We're good.
experience, like people who were most writhing in pain and who we gave
Yeah.
opiate medication to help them with their pain. And dental pain was very common. I saw that a lot. So, and we'd be like, go see your dentist as soon as possible.
Yeah.
Yeah.
People who break their jaws, is that
Yeah.
dental? Is that dentistry?
No, that's
No.
oral maxillofacial surgery, but
Oh,
you
okay.
can do MD-DDS. I think that's it, to pursue that
Yeah.
specialty. And you can go to dental school and then do a residency, or medical school and do a residency or something like that.
Hmm. Now
If
that
you'd
is
like
an
to learn more
interesting
about
career
that
path.
specialty, we actually had a
That is
presentation
interesting.
on it in our YouTube channel at National Pre Community. If you want to check it out, we do have that presentation up on that career specialty. It's pretty interesting. One of my current friends actually is pursuing that career path, and she's an intern right now in
Ah,
an oral and maxillofacial surgery clinic. So,
that is incredible.
so Allie, you could do that if you wanted.
Yeah.
Yeah, I didn't know that you could do that after dental school.
I'm
Sounds like
Yeah,
insensitive.
let me just Google real quick and make sure I'm not giving false information. All right, so this is how it works to pursue a career in oral maxillofacial surgery. At the end of your, like, you can go to dental school and like get a doctor of dental surgery or a doctor of dental medicine. Like you can figure out what you want to do, I believe, in dental school. But in order to become a oral maxillofacial surgeon, you do have to do like a residency or an advanced training, like a surgical residency. And I believe you can go to medical school as well and then just pursue that residency. But I think you may also need to go to dental school. If you're interested in
Yeah.
that, do more research on your own. I am not qualified to give accurate, like best information on that. But
Yeah.
again, there is a presentation on our YouTube channel if you want to check it out. And with that said, I want to do some would you rather questions, a little game. For some of you long-term listeners, we have been doing some games at the end of our podcast episodes for a long time, and then I recently stopped doing them. The reason being is because I got lazy and I don't want to be lazy anymore. And so we're going to do them again. So back to my classic little game at the end of the podcast episode. I want to start with this one. They're really funny. They're all pre-dental related. Whether they're actually funny or not is up to you.
They're
If
gonna
you
be
don't laugh,
hilarious.
my feelings won't be hurt. Okay. This is
Ready.
so stupid.
I'm
Would
so
you ra-
ready.
Okay. Would you rather have access to the latest dental technology but work in a remote area where your only assistant is a parrot trained to fetch tools, or work in a bustling city, but only work with equipment powered by hamsters?
Honestly, the first
Personally,
one sounds so good to me.
yeah,
I don't
I
see
think that
any
sounds
cons to that
fun.
one. I'm glad we're in
The
agreement,
parrot?
Allie.
Yeah, the
Yeah.
parrot. That sounds like a perfect dental assistant.
No. And he can just mock you the entire time while you work on the teeth. Okay,
True.
sounds good.
The only problem is he
Um,
might talk back, yeah. But that would be so fun. I feel like to have it's like Snow White. It's Snow White Dental Clinic.
yeah. Okay, how about this one? Oh my gosh. Would you rather have a guaranteed job at a high-paying corporate dental practice after graduation, but with a boss who insists on wearing novelty teeth every Friday? Or start your own private practice where the waiting room is filled with quirky singing dental robots?
I love the
Why'd
second
you
one.
laughing? The second one? Yeah, because
I-
then you have to work for corporate.
Oh, okay, that's another perk too. I just was enamored by the singing robots.
Yeah, to keep your patients waiting longer.
Yeah, that would be entertaining while they're waiting.
Are you also on the singing robot
I
side,
think
Allie?
so, yeah.
Imagine me with an army of quirky singing robots. Like I would be unstoppable.
I could see that. I could see it.
This one's pretty interesting. Let's see. A friend actually came up with this for me. Would you rather, if you would be a animal dentist, I don't know if that's a thing, but if you would be an animal dentist, would you rather do like generalized animal dentistry, like take care of dogs and cats' teeth generally, or would you rather do like zoo animals or horses' teeth or even tiger teeth or lion teeth? Would you rather have an excitement, adrenaline-filled dentistry journey or just a normal, boring one?
I think I definitely want to do it with the exotic animals. That would be so fun to see
Yeah.
what new animal is gonna come into the office.
Yeah, she's brave, so I
You have to
totally
get
think she could do that.
your hand chopped off. Okay.
Well, I feel like they would be like sleeping or restrained or
Yeah.
something.
Or like you would make friends with them because you're like an animal whisperer. You would like be petting the
Right.
lion or something.
Yeah, I'd find a way to make it work.
What about you, Lexi? What would you do?
Oh, I probably just do the normal.
You're just
The dogs
you're
and
gonna take
cats
it
are
easy.
cute. Yeah, I'll take it easy.
That's fair too.
Okay. All right, how about this one? Would you rather have to pay for dental school or have a full scholarship to a dental school, but that dental school has a cafeteria that only serves toothpaste flavored snacks?
I would definitely go to the one with the toothpaste flavored snacks.
Yeah, that's the only thing you can eat
Yeah.
every day.
Oh, well, can I go to the grocery store?
No,
Ooh,
you
she's
can only
finding a
eat at the dental
loophole.
school.
Oh, I think I would have to make it work.
Do you like
Uh,
mint flavor, Allie? Are
I
you like a
do.
mint
Mint
ice
is
cream
like my
girl?
favorite
Oh, okay.
flavor.
Okay, because I know a lot of people think that like mint ice cream tastes like toothpaste, but I love mint ice cream.
Oh my God, that's my favorite ice cream.
Me too.
Alex, I know you're listening. It's the best ice cream. And
Alex is not in support of mint ice cream.
no,
Oh my
he hates it.
gosh.
He thinks it's
We're
gross.
gonna have to have a talk about that. No, I'm just kidding.
I know. We're gonna have him on the podcast at some point.
Really?
Gonna roast
Oh,
him
I'm
the
excited for
entire time.
that.
That's my boyfriend, by the way, Allie.
Yeah.
He's like an unofficial team member.
We love him.
All right. Well, I think those are all of my would you rather questions.
Well, those were fun.
Yeah.
I like
enjoyed
thinking
them.
about, yeah.
Are
Never
there
thought about
any
that.
last things you'd like to share, Allie? Any last pieces of
Yeah.
advice you could give to younger undergraduates who are interested in dentistry or people who are thinking of changing career paths? Do you have any advice for them?
I think definitely just start early if you
Mhm.
know that you want to go into dentistry, or if you think you
Yeah.
might, just start as soon as you can getting experience, and you'll really be able to know then if that's actually what you want to do.
Yeah.
And yeah, if you're thinking about it, just give it a try, just shadow or do a volunteering experience. I know, I think there's a lot of opportunities like the clinic that I did where I got to meet the dentist that I now work for at.
Yeah, that's a great one. The free clinic.
Yeah,
Yeah.
it's just very fulfilling and it gives
Yay.
you some experience and then you can know if that's what you like and just start early, get your experience.
Yeah.
Yeah, that's perfect advice. The same advice I give to any of my pre-health students. Like experience,
Yeah.
experience, experience. Know what you're getting yourself into.
Yeah, I would
Well,
also
thank you.
join a
Go ahead.
pre-dental club early
Oh yeah,
in
yeah.
in college. Yeah, I didn't join until my sophomore year, and I wish I had joined my freshman year because it actually, like, I learned so much through that and got to meet so many amazing people.
Yeah.
So I would definitely join that very early too. You'll get a lot of opportunities through that and experiences with volunteering, and you'll hear about other experience. That's also how I learned about the trip to Panama. Like it's
Yeah.
just all around a great club to get involved in.
Awesome.
Very true.
Well, thank you so much, Allie, for being here and joining us on the Pre-Health Pod. It was so awesome to have you here. Are you guys doing anything fun this weekend before we tag off? Is that the right word?
Well, thank you for having me. I wanted to
Yeah.
say.
Yeah.
And yeah, I don't know. My mom's birthday is this weekend, so I'm
Yay.
celebrating.
Oh, happy birthday.
I have an engagement party to go to.
Oh.
One of my cousins is getting married soon, so that's exciting.
Oh, that's exciting.
Yes, I am very excited.
I'm going to a murder mystery party tonight.
Oh my
Ooh.
gosh,
What
that
does that
is so
entail?
fun.
I literally have a character.
Yes.
I'm gonna pull this up. It's actually really funny. So one of my
Yes.
good friends, she's amazing. It's her birthday party tonight. She literally
Please tell
emails
her
me.
that we said happy birthday.
Yeah, happy birthday, Olivia.
Happy birthday, Olivia.
She sent me this spreadsheet. It's amazing. She emailed me. She was like, "Hey, check your email." It's this long email about how to prepare for the party tonight. I
Oh
have
my
a role,
gosh.
I have a background, a costume. I got to memorize some like catchphrases from the 1920s because it's Great Gatsby themed. And there's 50 people on this spreadsheet with characters and
Wow.
biographies.
How does she even have 50 friends? I'm impressed.
That's what I thought.
Oh my gosh.
So you're
Wow,
gonna
she
be playing
really
a
thought it all out.
character.
I was like, I feel pretty good with like 10 friends max.
Yeah.
Maybe like one close friend.
Have you ever heard of the book A Good Girl's Guide to Murder? Have you heard of that book or read it?
No.
Well, it's a series, and one of the like novellas in the series is that exact premise. Like they go to a birthday party and they all have a character and it's a murder mystery.
Oh my God.
And they have to act and talk like their character the whole time. And it was so fun. But I didn't imagine that you could actually do that in real life. So that's awesome.
Well,
You'll have to
my
let us know how that
character,
goes.
I will. I'm really excited. And my character is Jazzy Fringe. My name is Jazzy. I'm a
Queen
flapper
Jazzy.
nightclub singer and a regular performer at Beanie O'Dannon's club, the Two Aces. However, my club is not as popular as House of Pones, Grand Gatsby, like club. So I have been after this other girl's job at House Speakeasy, which means I'm going to murder her.
Oh.
And I will stop at nothing to get what I want. And so I bought this flapper dress and like one of those fake cigarette holders and a little feather for my head.
This is so intricate.
Alex is a costume too.
Oh, that's so fun.
He's an aviator alcoholic.
Oh,
it's like that one Victorious episode.
Oh my gosh. It's also like the complete opposite of Alex. Like I would not expect anybody to put him as an alcoholic character, but wow, that'll be so funny.
I had homework for this party.
Yeah.
She emailed me. She was like, you need to text these people these things. I was like,
oh my gosh. And what does she do for work?
She's a
if I may
PhD
ask.
student.
Okay, there we go.
Yeah.
That explains a lot.
we're all
awesome.
You know,
well, it's just like that
nerd.
takes so much time and effort and like so much designing to make a party like that. I'm so impressed. So you have to be very smart to do that.
It's so refreshing to have a friend who's like passionate.
Oh, of course. Of course. Of course.
Well, there. That's what I'm doing after this. I'm gonna go make my vegan cherry cobbler and dress up for.
I'm so jealous.
Thank you again, Allie, for being in the podcast. It was
Thank you,
just so awesome
Allie.
chatting with you.
Of course.
And
Thank you so much for having me.
yeah, well, I'll roll the credits. This podcast was produced by Ari Rosenthal and Lorelei Edmonds. You can find our conference on Instagram, Twitter, and LinkedIn at National Pre-Health Community or NPHC 2020. You can also find our podcast on Instagram at the Pre-Health Pod. You can find all of our events, including our National Pre-Health Conference at nationalprehealthconf.org, which is conf at the end of there. Quick update about the National Pre-Health Conference. The date will be changing and it will no longer be that date in March. It will likely change to either May or June. The date is pending, so just please stay close to your email or check our website again at nationalprehealthconf.org for updates. And please leave a review, or tell one friend if you liked our podcast. Thanks for listening and see you in a couple weeks. Bye.
See you. Bye.